Welcome to PSY 318, Study Session 9, Childhood Indicators of Schizophrenia. Introduction. Schizophrenia is a profound psychological disorder that affects thought, perception, and mood. In this lecture, you will learn about definition, symptoms, diagnosis, prevalence, and treatment of schizophrenia in order to better understand the childhood indicators of schizophrenia. Objectives. At the end of this lecture, you should be able to 1. Define schizophrenia, 2. Identify the symptoms of schizophrenia, and 3. Explain the childhood indicators of schizophrenia. Pre-test. 1. Define schizophrenia. 2. Identify the symptoms of schizophrenia. 3. Explain the childhood indicators of schizophrenia. Content. The term schizophrenia was coined by combining Greek words that mean split mind by the Swiss psychiatrist Eugen Bleuler, 1857 to 1939. Although the definition of schizophrenia is controversial, 2004 defines schizophrenia as a psychotic disorder in which personal, social, and occupational functioning deteriorates as a result of strained perceptions, disturbed thought processes, unusual emotions, and motor abnormalities. People with schizophrenia experience psychosis, a loss of contact with reality. Their ability to perceive and respond to the environment becomes so disturbed that they may not be able to function at home, with friends in school, or at work. They may have hallucinations, first sensory perception, or delusion, first sensory perceptions, or delusions, also known as false beliefs, or they may withdraw into a private world. Another definition was offered in 1994 in DSM-4. In order to be diagnosed with schizophrenia, the symptoms must last for at least 6 months, and there must be marked deterioration from the individual's previous level of functioning at work, in social relations, and in self-care. The 5 symptoms according to DSM-4 category are explained below. 1. Delusions. Many people with schizophrenia develop delusions, ideas that they believe wholeheartedly, but that have no basis in fact. There are 5 kinds of delusions. Delusions of grandeur, delusions of control, delusions of persecution, delusions of reference, and somatic delusions. The deluded person may consider the ideas enlightening or may feel confused by them. Hallucination. This is the experiencing of sight, sounds, or other perceptions in the absence of external stimuli. Hallucinations are the perceptual signs of psychosis. They involve false sensory perceptions that have a compelling sense of reality even in the absence of external stimuli that ordinarily provoke such perceptions. In a schizophrenic, hallucinations are usually auditory, but they can also be visual or involve other sense organs such as taste and smell. Occasionally, children are diagnosed with schizophrenia, but this is very rare. For children under the age of 12, the prevalence is about 2 cases per 100,000 children. In late adolescence and early adulthood, there is a marked increase, so that the prevalence approaches the lifetime rate of 1 in 100. The risk for the onset of schizophrenia is strongly linked with developmental changes. Numerous studies show that parents state that long before the onset of clinical symptoms, they notice the same unusual behavioral characteristics in their pre-schizophrenic child, such as motor delays, emotional instability, and academic problems. Some parents report that they noticed subtle temperamental abnormalities in infancy. In most cases, clinical symptoms of schizophrenia are not apparent until the person reaches early adulthood. Researchers suggest that the vulnerability must be silent or unexpressed during the person's formative years. Pre-schizophrenic children differ from their elder siblings. They show more delays and abnormalities in motor development during the first 2 years of life. Among the abnormalities observed were weakness and unusual positioning of the left arm and leg. The early signs of schizophrenia falls into several domains of behavior, such as motor, interpersonal, and cognitive. Secondly, many pre-schizophrenic children show the most pronounced adjustment problems when they enter adolescence. Thirdly, the more severe the childhood problems, the earlier the onset and the more severe the illness vulnerability to the disorder can be inherited. Events that occur during the pregnancy and delivery, such as obstetrical complications, can increase the child's risk for schizophrenia in adult life. The leading psychological explanations for schizophrenia come from the psychodynamic, behavioral, and cognitive models. There are also sociocultural and deities, stress explanations. For several years in the past, efforts to treat schizophrenia brought only frustration. The disorder is still difficult to treat, however. Therapies in the contemporary world are more successful than those of the past. In the past, the main treatment for schizophrenia was institutionalization and custodial care through overcrowded public institutions such as state hospitals. Nowadays, the discovery of antipsychotic drugs in the 1950s revolutionized the treatment of schizophrenia. Psychotherapy has also been employed successfully in combination with antipsychotic drug. A community approach to the treatment of schizophrenia also began in the 1960s. Summary: the term schizophrenia was carried by combining Greek words that mean split mind. In order to be diagnosed with schizophrenia, the symptoms must last for at least 6 months. The definition of schizophrenia is controversial. Coma, 2004, defines schizophrenia as a psychotic disorder in which personal, social, and occupational functioning deteriorate as a result of strained perceptions, disturbed thought processes, unusual emotions, and motor abnormalities. Delusions are ideas that people with schizophrenia have wholeheartedly but have no basis in fact. There are 5 kinds of delusion: delusion of grandeur, delusion of control, delusion of references, delusion of persecution, and somatic delusions. Hallucinations are the persistent signs of psychosis. Children are diagnosed with schizophrenia, but this is very rare. The risk for onset of schizophrenia is strongly linked with developmental changes. Antipsychotic drugs and psychotherapy are used in treatment of schizophrenia. Post-test. 1. Dash coined the term of schizophrenia in 1857 to 1939. 2. A psychotic disorder in which personal, social, and occupational functioning deteriorate is called Dash. 3. Psychosis is a dash with reality. 4. According to DSM-4, 1994, in order to be diagnosed with schizophrenia, the symptoms must last for at least dash months. 5. Delusions are dash. 6. The experiencing of sight, thought, or other perceptions in absence of external stimuli is called dash. 7. Unusual behavioral characteristics in pre-schizophrenic children includes A dash, B dash, and C dash. 8. In the past, the main treatment for schizophrenia was dash. 9. Recent treatments for schizophrenia includes A dash and B dash. End of study section 9. Thank you for listening.